Hello, this is Libin, and I'll be doing the sensory integration theory. In this theory, in this following presentation, I'll be explaining what is sensory integration theory and how it relates to pseudoscience. Sensory integration theory is a therapy-based intervention typically used by occupational therapists. It explains on a relationship between the brain and behavior and why individuals respond to sensory and how it affects behavior. It was developed 20 years ago during the late 60s to early 70s by A. Jane Aras, an occupational therapist who has advanced training in neuroscience and educational psychology. She developed a theory about when sensory integration does not develop and ways to treat it. She created the research to further develop the theory, which can aid in her treating many children. It is commonly used to help children with developmental behavioral learning issues such as ASD, attentional deficit hyperactivity disorder, as in ADHD, developmental coordination disorder, and childhood obesity. What is supposed to improve? Sensory integration is for people with sensory processing difficulties or who has trouble understanding sensory input. So it's used with physical activity and exercises to help children to effectively interpret and use sensory information. The five senses that are affected in this theory is touch, sound, sight, taste, smell, and visual. The theory claims it can improve difficulties associated with autism, like challenging behavior or repeated behavior. Therapists suggest that sensory can help the child. Other characteristics like difficulty with play and emotional regulation. The therapy suggests an assessment of the child with an occupational therapist and they plan and conduct a program which include a various of activities to stimulate sensory to the child. It designed programs that include communication, behavioral, and emotional therapies. When used, parents were told to implement some of the activities at home as part of the program. Therapists working as a child will prepare for and plan and ways to techniques to be used. Activities can include deep pressure joint compression and oral exercises. The activities help in more than one sensory and help to trigger response of muscle and joint in the ear and skin. How does it fit with pseudoscience? Sensory integration theory does not explain why children behave and does not help plan intervention. It also does not predict how behavior will change within result of the intervention. Some of the framework of IRAs has not received verification of the neurological level, which is showed with the lack of validation by current lectures. It is also unclear how the therapy helps children. It doesn't fully explain will the children become less sensitive to touch or smell. Studies also show the therapy has a negative effect on clients, like increase in self-harming and increased repetitive movement like body rocking and arm waving. Also, there's not enough information to show benefit to the children who have received this type of therapy. It's also possible that generalizing the behavior of an individual is harmful to the disorder. Thank you, and this will be my end of my presentation.